Good morning, Lagos, Nigeria. Here we go again. Welcome to COVID-19 Heroes. I'm Femi Obong-Daniels, and I never do this alone. Not without the man of the moment and of the hour who's been busy trolling the enemy camp on social media. Good morning, Wiebe. How are you doing?
I'm very, very good. I think you need to elaborate on that so that our guest doesn't think that I'm a bad guy. Please, what exactly do you mean?
What did Man United do to you?
No. The Arsenal jersey is beautiful, and then Adidas created the Man United jersey looks like a carpet. It's horrible. It's good. I'm happy.
They say Arsenal fans are like Nigerians. Just give them a little success, they're fine. Is it this FA Cup you managed to win? And then, you are now better than everyone else.
Yes, we are. Yes.
All right. Wiebe Boer for you people. Welcome to COVID-19 Heroes. And oh, what a superhero we got joining us on the show today. Wiebe, do us the honors.
All right. Yes. Good morning, Femi. Good morning, Lagos. This morning we have Dr. Kemi DaSilva Ibru, who's the founder of the Women at Risk International Foundation. So thank you, Dr. DaSilva, for coming on the show. Hope you're well this morning.
Very well, and thank you very much for having me, Wiebe.
All right, well, and Femi, Wiebe and Femi. Don't forget Femi.
How are you doing?
Very well, thank you. I'm also a gunner, so I'll just put that out there before we start.
Okay.
I was thinking of wearing my jersey, but I thought, you're too elegant. I can't be doing this with a jersey. So, all right, it's right here though.
Just in case. Yeah, it's a fine one. It's a fine one, really. Yeah.
You see, all right.
Yeah,
okay,
yeah,
all right.
yeah.
See, all right, okay.
Wait. Have you seen the new Real Madrid jersey?
No, I haven't.
Okay.
They always look the same, just a little bit different color. That doesn't change.
All right. So quick one, just in case. For those joining us, we're talking about the impact of COVID-19 on gender-based violence, and that's why we have our guest and hero, Dr. Kemi DaSilva Ibru, who's founder, Women at Risk International Foundation, or for short, WARIF. Yeah. Wiebe just did us the honors. Wiebe, you want to fire the first salvo?
Sure. Okay, so our first question is really just, Dr. DaSilva, for you to give us a little bit of background of how you became such a passionate advocacy for gender issues. How did that start? What was your training, that kind of thing?
So my background is in healthcare. I grew up in a family of healthcare practitioners. So very early on, I had a pretty clear idea of where my interests lay, because I was always constantly surrounded at home by, cases, conversation, and I always found it very fascinating. So deciding to go to med school was something that, as I said, I was one of those children that I was always imagining my white coat and my stethoscope and so on and so forth. So went to med school, finished, went on to postgraduate degree in the States in obstetrics and gynecology. Decided at that point in time that my interest would probably be better spent expanding into public health, because my intention was always to come back Nigeria. So back to Johns Hopkins in Baltimore, and got my master's in public health, in international health, and started to appreciate, if you will, disenfranchised groups already in the United States. So when I came home, I decided I was going to focus in the public health system. So I started working in one of the public health facilities in Ikeja. And again, I was exposed to disenfranchised groups of women that were being brought in. However, back then, there was very little infrastructure available to them outside of these public settings. And so unfortunately, these health centers don't have the necessary skills, if you will, and to be honest, the sensitivity that comes with these skills to address these particular cases. And in terms of the services that were offered, again, medically, cuts and bruises were attended to, but the additional assistance that's as necessary, if not more so, the psychosocial counseling, for instance, and the social welfare wasn't addressed. And so I started to pay more attention, and I started to find myself being compelled to address these cases on a one-on-one, because that was all I had available to me, my medical capacity. So moving on from there, over the years, I started working with other women groups and other non-profits that were already in the space. Again, offering my services as best as I could pro bono.
All right, so let's look at one of these issues you've been addressing specifically. And you've been passionate about addressing the needs of expectant mothers and women. And I'm wondering, is this connected with your medical background, or was it just a passion? When did you develop this passion?
No, so it was and is directly connected with my medical background. Following on from medical school, there's a year that's referred to as an internship year, where you spend time rotating through the different specialties. And when I started in the OBGYN specialty, it was very clear to me that my interest at that point in time had found a home. I was able to operate. I have a great love for the operating room and surgery, but I also had that privilege of being able to bring life into the world. So for me, it was a win-win. And so the decision to then specialize in obstetrics and gynecology was very clear to me.
All right. So, and Femi, she mentioned that she did her public health degree at Johns Hopkins. That's basically the best school in the world for that. So, this is a superstar right here.
Fantastic.
So, so now from there, then you set up.
Did I not say we had a superhero?
Yes, superstar, superhero. You bet. So, but what is the story behind the foundation then? Because obviously your background kind of tells a story, but I guess you could have just continued, working in the public health system, doing one-on-ones, but you now tried to institutionalize it. So what's the story behind the Women at Risk International Foundation? And what led to you setting that up now?
So as you said, I started working with these groups, offering my services as a practicing gynecologist, which I still am. I still run a practice. And this continued, but I always knew that there was more to be done. As I said, I always knew that there were more services that should be offered. And I felt that it needed to be a bit more deliberate, that more structure needed to be put in place. So 3.5 years ago, I had a string of awful cases. I had a 2-year-old that had been violently raped by her father, and I had to take her into the OR. I had a young child of only 12 that was pregnant, and we had challenges trying to decide how to deliver her. And every one of these cases weren't new cases, because over the years we have seen horrific cases. But I guess for me, the line in the sand was the fact that there were just so many aspects that we just couldn't address. And we had to keep asking and looking for assistance outside of, at least I had to ask for assistance outside of, my sphere of influence. And so deciding to establish the nonprofit was so that we could have a survivor-centered approach in terms of the infrastructure that we offer. And so WARIF is the acronym for the Women at Risk International Foundation. And very simply, it was established to address the prevalence of rape, sexual violence, and trafficking of young girls and women in communities across Nigeria. If you do a needs assessment in this country, needless to say, in my opinion, this is an epidemic that has always been, but more so now, it's become a national conversation. But the statistics of 1 in 4 girls having experienced one violent sexual encounter before age 18 are statistics that we've had since 2014. And we know for a fact that probably even much earlier, but we just didn't have access to the data. So we're dealing with a country where we have 200 million people, and half of us are women, and 64% of us are under the age of 24. So that's over 10,000 girls every day being raped or sexually abused somewhere in Nigeria.
Wow. Okay, so let's go to the specific reason why we, we requested that you grace us with your time and your presence today. So I want you to tell us about the WARIF COVID-19 response to rural communities, the project that you have going down. I'd like a background. What led you and your team to set this up?
Right. So to put it into context, to achieve our overarching goal at WARIF, we've implemented a unique approach. It's referred to as the WARIF strategy. where we work on the three specific pillars. We have our health pillar, we have our education pillar, and we have our community service pillar. Our health pillar was essentially an intervention, where women can receive services and care. Under our education and community service, the idea behind this was, how do we prevent? How do we start to look at this through the lens of prevention? And then how do we measure? Because there's a dearth of data in Nigeria with regards to this issue. So from the inception of the organization, we had our deliberate approach, our three pillars, and then we had a strong monitoring and evaluation to address the needs assessment, but also to measure our impact. So under our community service, we had an initiative that was called the Gatekeepers. This is where we went into rural areas to address the problem of gender-based violence. And the reason for this is because many a time when we talk about Nigeria, people assume outside of Nigeria that Lagos is representative of Nigeria. The city, the bustling city with the music and the lights and the rich culture. But in reality, 54% of Nigeria is in the rural area. So in spite of the fact that we had set up an elaborate system using social media and internet access and jingles, we couldn't reach the community that were far out and grassroots. So we took initiatives into these communities. We identified who we referred to as gatekeepers, and these were just trusted, respected members of these communities. And very quickly, with my OBGYN hat, I appreciated the fact that a traditional birth attendant, a local midwife, mostly women that live in these communities, they serve as health practitioners. So these are the women that are the custodians of secrets, they're aware of the cases of abuse, and when they happen, sadly, they're not equipped to deal with them. So we decided over the first 2 years, because WARIF is 3.5 years old, to train over 1,000 of these gatekeepers in 15 local government areas, teaching them to be first responders, teaching them to identify the cases, and more importantly, to refer the cases back to our center, which falls under our health pillar. When the COVID pandemic came about, a shadow pandemic became apparent, because what happened was, to stem the spread of the virus, mandatory lockdowns were instituted across the world. And they are effective as a preventative measure. But what then happened was, women were now trapped in isolation at home with their abusers. So we started to see a spike in the cases of gender-based violence globally. I mean, the UN Women would tell you that it's a 20% spike that's been noted across the world. What we observed in the first 14 days of our lockdown was a 64% spike in our call rate, in our 24-hour confidential call lines. And 72% were women asking for help because they were trapped at home. So we decided that we would go into the communities, we would galvanize our gatekeepers that we had already trained, and we would ask them to please go into their communities, literally door to door, to establish a presence, to find out who is at risk, to offer the necessary advice, and then to refer cases as and when they occur. So the WARIF COVID response in the rural community is simply an extension of our gatekeepers, given the fact that there was a need that became apparent during the COVID-19 pandemic.
So Dr. DaSilva, I want to dig into that a little bit, because it's obviously very, very troubling. I mean, I think the broader conversation around COVID, I think this issue of gender violence, you hear it a little bit, but it's not really pronounced. And it sounds like in Nigeria, it was, I mean, the 20% globally, but in Nigeria it was much worse than that. I mean, is this still carrying on now, or with the lockdown sort of eased up, is it a bit different, or is it still really, really a shadow pandemic like you described?
I mean, I would say that it's still a shadow pandemic, reason being that people are still very much in that phase of working remotely. The world has changed. We've all pivoted in terms of even the way we run our businesses now. So you're going to find that more and more there'll be homes where the basic structure and dynamics in the home has changed, where perhaps a volatile husband would go out during the day to work. He might not be working remotely at home. And then, of course, we're all faced with the insecurities of health, the worries of financial, paralysis. and all the other challenges that the pandemic has brought to bear. So we are going to sadly see these cases, and I don't think it's going to stop anytime soon.
Interesting. You're going to have to forgive me. I'm going to hit you with a barrage of questions now, 3 in 1. Let me start by the fact that you chose 5 locations, 5 local government areas in the state for your COVID-19 response. You want to tell us what those 5 are and why those 5? I'd also want to know what impact has been made through this project so far, if there are any standout stories you want to share with us.
So we were very deliberate in our choice of the local government areas. We decided to visit Alimosho, Epe, Ikorodu, Koshofe, and Apapa. Reason being that these were the local government areas that had the largest percentage of women. Mm-hmm. And so the idea was, if we were going to impact on this issue of gender-based violence in these rural communities, we needed to target these local government areas first. And Alimosho, as we know, being the largest with over 5 million people resident. With regard to the impact, the very first cycle, when we galvanized our first 50 traditional birth attendants, in a 4-week period, we were able to sensitize 10,744 individuals. And so this is an ongoing program. Completing the first cycle was something that we needed to show, not just in terms of evidence-based, which is important to us, and in terms of the impact we could measure, but to actually see whether or not it was necessary. Because it's one thing to make the assumption that there was a need, but it's another thing to have definitive data to support that. And we did get that data. We got that data not just with the numbers that we were able to reach, but with the referrals that we were getting from these local government areas back to the WARIF Rape Crisis Center. And so this was a measured, if you will, an initiative. And as it's ongoing, we're seeing more and more these referrals even today.
Okay, so you also, as part of your COVID response, WARIF has set up a volunteer response program. So please, I imagine that this is basically to now help address this increase in violence and so on. So how is this helping? How does it work? And how do volunteers sign up? But then also, how do people who need help, how do they reach out?
So volunteers sign up either with our volunteer form on our website. Many of them have access to our social media platforms, so they send messages with an interest or asking for to show support in some way or the other. Or some of them just visit the WARIF Center to ask, what's available and that they would like to assist. We have over 100 volunteers that have not only been registered, but have been trained by us. So we not just sign you up, but we actually take you through a training process because, as I said, we're very deliberate with our initiatives, and we want to ensure that whoever it is that's working under those initiatives is very much aware of what the goal is, what the aim is, and that they can adequately implement that. Okay. The volunteer program was in response to the same issue, but in urban settings. Okay. So we felt, as a result of this spike, the fact that during the lockdown, many women could not access the Rape Crisis Center because they couldn't reach us, they couldn't get to us. Mm-hmm. So we felt if we were able to, again, galvanize our volunteers to go into urban settings, marketplaces, if indeed people were there, homes along the streets that they were resident, to again raise the awareness to this particular issue of gender-based violence during the COVID pandemic. And so again, we recognized that we needed to identify highly populated, congested areas. So we targeted, again, 5 local government areas in our first cycle. We went into Festac, we went to Lagos Island, the Obalende Axis, we went to Oshodi, we went to Yaba, we went to Surulere, to Ojuelegba. And we were able to sensitize almost 10,000 individuals. Recognizing that this is not enough, we appreciate that we need to go back in. But as a first cycle, again, we were able to see the impact because we were now getting referrals back to the center.
It's a very scary picture brought on by this COVID-19 induced lockdown. And the mind can comprehend what it means if you're already in an abusive relationship and then having to be in close proximity to the abuser. So I'm not surprised about the 20% globally and perhaps more than 60% locally here. Let's go specifically into the victims and survivors of gender-based violence throughout this period. How have you managed them? And is there any existing partnership with government to this regard, or perhaps some other partners outside of government?
Right. Well, we work with both non-governmental agencies as well as the government. We're fortunate enough to be official partners and members of the Lagos State Domestic and Sexual Violence Response Team. And so we have to work alongside this particular agency with regards to this issue. At WARIF, we work, as I said, under our health pillar by implementing prevention and post-incident care, our rape crisis center. So the WARIF center were able to keep open in spite of the mandatory lockdown. We had to immediately pivot, as we all did, by ensuring that all frontline workers had necessary personal protective equipment so they could adequately see survivors when they visit. We had to, of course, implement the social physical distancing. We had to ensure everyone walking through the facility is masked. We had sanitized areas where we ensure that, children, because 78% of the survivors that we see at the Rape Crisis Center, sadly, are under the age of 18. I mean, we've opened for 3.5 years now, and we've been able to successfully manage 1,700 beneficiaries at the center. So by doing that, we were able to ensure that all the necessary precautions were put in place and were met to be able to effectively see and care for survivors. In addition to the medical attention, we also run forensic medical examinations on our survivors. And so we're very mindful of the fact that this involves, specimens and fluid. And again, the risk of cross-contamination had to be taken into consideration. And then with the psychosocial counseling that's also necessary, and then the social welfare. And this is where working with the government, for instance, is so beneficial because we could leverage off existing shelters and we could leverage off the Office of Public Defender for those that needed legal aid. And then the vocational skills, because women sadly make poor choices because this is a patriarchal country and we're generally subjugated as women living in this environment.
So Dr. DaSilva, for all of this work that you've done with specifically around COVID, but even broader for the foundation, is this all self-funded or do you have other partners? I mean, this is a big operation, and I'm just wondering, how are you managing all of this?
So as with all nonprofits, we rely solely on donor funding. I mean, donor funding could come as an individual private donation. We work with corporations and organizations that are willing to partner with us on some of our initiatives. And then we get grants. For instance, presently we're working with the EU-UN Spotlight, the UN Women, on an educational initiative in universities.
All right, let me ask you my final question, and it's always my favorite question. And it has to do with how people can benefit or know women at risk or who are themselves women at risk. How can they reach your organization for help?
So for anybody that's at risk, any person that needs assistance, you can visit the WARIF Rape Crisis Center. We're at number 6 Turton Street off Thurban Avenue in Yaba. It's a walk-in facility open Monday through to Saturday, and all the services available are free of charge. You can also use our social media platforms. We are at WARIF_NG on our Instagram and Twitter, and we are at WARIF-NG on Facebook. You can send us direct messages and we will respond immediately. We have a 24-hour confidential helpline manned by qualified counselors. The number is 0809-210-0009. I will repeat that, 0809-210-0009. Again, please make that call. And then we also have a live chat by counselors on our website. So either reach out to us using social media, reach out to us with a phone call, visit our center, or hopefully meet one of our volunteers during our COVID run or one of our traditional birth attendants in a rural community that can also share this information with you.
Just to add that WARIF is spelled WARIF. WARIF.
So Dr. DaSilva, I know we're running out of time now, and Femi is going to kick us off soon. So I just wanted to end with a final question. So if the COVID pandemic, it will go away at some point, but the shadow pandemic that you're talking about will persist. And your work is largely focused on Lagos, but this is a desperate need all over Nigeria. Are there similar organizations to yours doing these types of things around the country? And then also, do you have plans to now expand further and grow to provide this type of desperately needed support nationwide?
So we're already working outside of Lagos. So we actually have satellite services up northern part of Nigeria. And we're also planning to have additional services down south. So this is already something that we do. There are other organizations that, yes, are available in the different states that we partner with, because partnerships and collaboration with a problem of this magnitude is critical for us to effectively impact and reduce or eradicate the problem in our society. I think it's also very important to mention that I believe each and every one of us, we have a collective responsibility here to address this issue, whether it's in our home, whether it's in our workplace, whether it's in our community. I think corporations and private sector need to get involved. I also think that the government is doing a lot, but certainly a lot more can be done.
Dr. Kemi DaSilva Ibru, founder WARIF, that's Women at Risk International Foundation. Thank you for your time. You are our hero and a superstar. I'm sure you know Nigeria Info. Yeah, we've been your partners, your partners over time, and we will continue to support you throughout the country. Anything you need, just call.
Thank you very much, Femi, and thank you, Wiebe and Femi, for having me on this morning.
Yeah, Wiebe, we gotta go. Take us home.
All right. Well, thank you once again, Dr. DaSilva. This has been. I mean, it's been, I think, deeply moving. Your passion for this, and as Femi said, I mean, everything that can be done to partner with you and make your impact greater, I think, is very important. So thank you for being on. Thank you for doing what you're doing and putting yourself out there in such an important way.
Thank you. Bye-bye.
Bye-bye.
Set your time on 99.3 Nigeria Info, the correct time.